Hi, I'm Dr. Teresa Lee. I'm a medical oncologist and I treat head and neck and sarcoma cancer patients. I usually will do systemic therapies, and that means things like pills or IV medicines that can travel through the whole body and treat cancer. As the medical oncologist, there is a very specific and helpful role that we can play in sometimes kind of quarterbacking or just being a coordinator between teammates. I do rely very heavily on my colleagues and my teams because both head and neck and sarcoma cancers really need a very multidisciplinary approach. There will be almost always roles for things like radiation and surgery. It depends on the patient and the situation at different times as well. I think head and neck cancer patients do have some very unique needs. I do think some of the treatments we have end up being some of the more difficult to get through for patients, but they also have, in some cases, very high chances of good outcomes. The head and neck program here, I think, is one of the strengths of Fox Chase Cancer Center. We have very dedicated and skilled people in all the different disciplines, and I think working together is one of the things that you really need to come up with a good plan for anybody. Sometimes there are multiple options and they really have to understand what's right for them. I do think that specialization is really helpful when even things like diagnosis can be in question. And I think that sometimes you have to make sure that even from the very first step that you are getting people who are experienced and have seen some of the more unusual presentations to take care of you, because that really does impact our outcomes. Sarcoma patients, I think, have some very unusual needs. I think coming to a center where we see a high volume of these cases and have people who are experienced in all of the different disciplines in sarcoma care is very important. I think that there's a lot of things that need to come from the lab in order to let us have options in the future. I think what excites me about what's out there now is that there has just been such an explosion of our abilities to apply all of these molecular testing and or even drug selection to patients on an individual level, which wasn't even possible, I think, 10, 20 years ago. I would say that my treatment care philosophy hinges around the fact that everybody's journey is unique. Everybody brings something different to the table in terms of their own beliefs, their own hopes. We will talk through the options and we will try to find something that fits with what they think is going to be important to them.